I've been a consultant at Barts and the Royal London Hospital, two of the most prestigious teaching hospitals in the country, over the last 14 years or so. And during that time, I've really dedicated my life to working in this field of nasal and facial plastic surgery. This started as a passion for me during my training, which was largely in the UK, but thereafter I went off and did a very specialized facial plastic fellowship based both in Europe and North America. I was really privileged to work both in this country and abroad with some of the best facial plastic surgeons in the world, as far as I'm concerned, who have really been mentors to me over this period of time. I spent some time in Amsterdam, in Toronto, and then in one of the Harvard University affiliated hospitals in Boston, and really was able to get a breadth of surgical variance, a breadth of surgical practice that complemented everything that I've learned in this country as well. In the NHS, I dedicate really to doing this sort of very specialist work, and I get referred quite a lot of complex cases, both from within London and all over the country, really by reputation for what I do, particularly with regards to complex nasal work. I'm also part of a very specialized facial trauma unit where we look after patients that have been flown into the Royal London Hospital from our area with really quite severe facial trauma, and we work together as a group to try and reconstruct faces. And that's really helped me in developing both a reconstructive and, of course, a cosmetic practice, because we're always trying to make our patients look very much more better than they were following the trauma. I teach a lot regularly. I have a variety of teaching commitments, both from teaching medical students right up to teaching surgeons, both nationally and internationally, and I get invited to a variety of meetings as a result. And that, as a result, I'm an honorary lecturer at Queen Mary's University Hospital, which is affiliated to Barts and the London as well. So I spent a lot of my time in academic practice as well. As part of that, we write peer-reviewed papers on some of the work that we do, which is innovative, particularly with regards to some of the facial trauma work that we've done, where we're really regarded as one of the foremost facial trauma teams, certainly in this country and really Europe and worldwide. Above and beyond that, I teach at international meetings, and I'm invited to do so all the time. At a point where sometimes we have to say no because just of the number of invitations I end up getting. This is obviously very important because it makes sure that you're at contemporary practice, and not only am I able to lecture at these meetings, but I'm also able to hear some of the best speakers in the world, which also allows us to share knowledge, and that's clearly important. No matter who you are, no matter how well you're doing in your practice, it's really important that you make sure you take on board what other people are doing, and we all share ideas and we all really learn from each other, and I learn just as much as I teach. I spend a lot of time as part of the European Academy of Facial Plastic Surgery. Currently I'm treasurer of the European Academy, but I've also spent a lot of my time dedicated towards producing a certification process, a robust certification process that makes sure that people like myself, facial plastic surgeons, are trained in a very, very high way and are able to share that knowledge so that they have to pass an exam and they have to produce cases that show that they're really doing the highest quality of work. So I've been looking after this for about 14 years, but over the last 4 years I've set up what's called the European Board for Certification in Facial Plastic and Reconstructive Surgery, and I'm the inaugural president for that. This is really trying to make sure that we are treating our patients at the highest possible level, and it's a particular passion of mine to ensure that this is the case so that we protect the public from unworthy and unscrupulous practitioners. I publish a lot of the work that we do, particularly in chapter writing, and I think I'm just writing the 12th chapter over the last 10 years of my practice for a variety of internationally renowned textbooks. At Symmetry Clinic, we're really trying to provide the very highest level of care for all our patients. That's important to me. It's not just about running a clinic, it's making sure our patients are satisfied, they're happy, and happy patients ultimately bring other happy patients along. That to us is the key, because they're our patients, they're not our clients. and they never will be our clients. We look after our patients forever, and we have a really happy relationship with them. From a surgical point of view, we provide a variety of different surgical services, all of which are dedicated to really optimizing facial and nasal care. The good news for us is most of our work comes as good old-fashioned word of mouth. Up until recently, we didn't even have a website, and that really is, in this modern day and age, saying something. We have patients who work as advocates for our care, and we hope to be able to provide the same level of service for everyone.